When 2020 hit, we thought this is the year that this model is really going to demonstrate that we are ready to have the impact I've always had in my heart. Who would have thought how prophetic those words would be when the pandemic hit?
I was medical director in the facility, which had one of the first outbreaks. Over 140 became infected. 51 patients eventually passed away. And so it was a feeling of helplessness and realization that we have no excuse for continuing the old models of warehousing residents in shared rooms, in cramped spaces. Greenhouse had it right to begin with. It's something that can save lives in the middle of a pandemic, and so it serves so many more purposes than simply providing a good living space. It provides protection.
Because of the staff size and the elder sizes in the houses, it's much more manageable to deal with the pandemic.
One by one, they were saying, fingers crossed, so far we're COVID-free. Not that we didn't have cases, but for the most part, we were significantly faring far better. Never before have nursing homes and aging services more broadly been put in the spotlight. The New York Times, HuffPost, New York Magazine, among many others, started reaching out, and they would ask about our COVID numbers. And getting Cheryl involved was a godsend.
One of the things that most passioned me about wanting to be involved with the Greenhouse Project during COVID is that it just felt like a slam dunk to say, this is a model of care that probably has fewer infections because they're smaller, so there's less chance of people coming in and out with infection, likely more ability to control exposure when it occurs, and also that there really might be something to avoid a lot of the other negative components of COVID.
I was a member of the CMS Coronavirus Task Force. I've testified twice to the House of Representatives about COVID in nursing homes. Everything about the Greenhouse model allowed it to fare better during COVID. The small home aspect of Greenhouse, we know that larger homes were hit much harder. Fewer staff coming in and out of the building. Beyond that, the consistent assignment and better pay for staff is also going to help protect them. Residents feel more engaged, less isolated, and all of those are going to allow residents to thrive better during a pandemic.
To date, we have had 0 of our elders come down with the COVID virus at all, which is truly amazing. It's been a true testament to the Greenhouse model. We were able to get our elders out of their rooms from lockdown and isolation earlier, keep them safe, yet still have some social interaction.
I know what it is to build a nice traditional facility, but a greenhouse is exponentially better than that. All the new campuses that we're developing now are exclusively greenhouse because the model works.
It's time to rethink nursing homes. And here's the deal, we don't have to reimagine because we've already seen what has worked well. The Greenhouse model was made for this moment.